On Thursday, the Biden administration will end the public health emergency for the coronavirus pandemic. This follows the World Health Organization declaring an end to the pandemic emergency late last week. So Dr. Nidhi Kumar is on call this morning to explain how this news may impact our health. Good morning to you.
Good to see you.
Good to see you. Let's talk about this public health emergency being ended. I mean, what are your thoughts about it? What changes can we expect?
Yeah, well, first off, there's going to be an end to those required vaccinations for all individuals, including international travelers, an end to required reporting. There's also going to be some economic changes because healthcare coverage is going to change. For many people, COVID tests may not be fully covered. COVID vaccines may not be fully covered. There will be reduced coverage for telehealth visits, and probably what's most significant is a lot of people are going to lose their eligibility for Medicaid and CHIP, which is the Children's Health Insurance Program. Because when we were under the emergency status, there was wider access to these programs to limit the spread of the virus. Now that that's ending, a lot of people will lose coverage, and you know, it's unclear how these economic changes are going to affect public health. It's as unpredictable as the virus itself.
Well, such a good point there. Let's talk about the move by the government. Is this decision based on science? I mean, what have you seen?
Yeah, so there's really been a shift in the virus from pandemic to endemic. So while there is still a constant presence in the community, it's more under control. Our healthcare system is not being taxed. And a lot of this has to do with the Omicron variant. Because if you remember in December of 2021, when we had that enormous surge of cases, a lot of people tested positive. And what happened is we developed a lot of natural immunity in our population. So co-evolution took place. While the virus evolved, we evolved as well. Our immune systems are in a better position then to respond to this variant and future variants.
Speaking of the latest variant, can we talk about this one? And what are you seeing in regard to symptoms?
So Arcturus, this was first reported by the World Health Organization in January of 2023 in India. It's a subvariant of Omicron. It is the most contagious variant that we have seen yet. However, it does not appear to be increasing hospitalizations or causing severe disease. But the new big symptom is conjunctivitis, which is pink eye. Those itchy, red, irritated eyes. Patients can also have fever. They can have cough. And some people report feeling unhappiness, malaise, just feeling blah. Now, the amount of disease circulating right now is probably underestimated because there's such an overlap with seasonal allergies. But the good thing about Arcturus is that pink eye symptom, because it clues you in that this could be COVID. The other big, take home from this is that this virus is continuing to evolve. There will be more variants, so we can't completely let our guard down yet.
Let's talk about how people can stay healthy right now in the situation that we're in.
Okay, so the CDC is recommending that if you are age 65 or older or at risk, you get your COVID vaccine. However, there is no data on the efficacy of the COVID vaccine against Arcturus, but it is an Omicron subvariant. So the belief is that it will help you from getting very sick. Isolation period, still 5 days. Wear a mask for another 5 days because that infectious period is still a total of 10 days. Tests, vaccines, medications, these were important parts of controlling the virus. Now that there's going to be less access with these changes that are occurring, we're going to see more circulating in the community. So we really want to keep our immune systems up. Exercise, eat well. Don't stress the small stuff, and get good sleep. Everything you can to be healthier, because the healthier our population is, the better equipped we are to deal with whatever variants come down the line, and the less disruptive the next variant will be.
Dr. Nidhi Kumar, thank you so much for taking some time to talk to us this morning. We appreciate it.
Good to see you.